Cassandra Josephson, the medical director of the Cancer and Blood Disorders Institute and medical director of the Blood Bank and Transfusion Medicine Service. My brother was diagnosed with Hopkins disease right before I entered medical school. He was telling me about his fears, and he was telling me about what it felt like to have cancer. And at that same time, I was able to talk with his doctor and see how she handled that. The combination of those two things really set me on my path to figure out, well, how could I be like that, and how can I help cure that disease, but other diseases like it? And luckily, my brother came through therapy very well. One of the things that was so interesting after my brother had cancer was trying to understand what was wrong with the cells and what was wrong inside the blood and inside the tissues which make up the organs in your body. And at that moment, I knew that I wanted to be not just treating patients, but trying to find out the answers to why these diseases actually happen. And the blood was so interesting because of all the cells, and a lot of cancers actually start in the bone marrow that gives rise to those cells. So it kind of was this whole integral, how everything fits together that just fascinated me. And as I learned more in medical school about disease, I had so many questions and I wanted to answer them all. And I wanted to answer them in kids.
Hey, how are you? You're doing good.
The Cancer and Blood Disorders Institute has the oldest and largest transplant center in Florida.
That's very good.
The patients who we see within our institute have cancer, but also have different blood disorders such as sickle cell, hemophilia, which is a congenital bleeding problem. Some patients have blood clots, we call them thromboses, and some patients need transplants who don't have cancer and who do have cancer. And so there are special ways that we are able to take care of those patients to cure them of whichever disease they present to us.
You sound really good today.
In the blood transfusion world, I am actually the medical director, so I oversee all of the blood products that are delivered to all children within the hospital and how those products are transfused to the patients. Blood transfusion is a complex process because we are giving blood that is donated from adult donors, and we are giving it to pediatric patients. And that in and of itself creates some intricacies that physicians need to weigh in on when we're giving those products. And these products are red blood cells, platelets, plasma, all the different components that make up blood. And so when those are all broken out, there are different times, different volumes, different rates with which we have to give those products depending upon what's wrong with the patient. These products are life-saving. What makes the Cancer and Blood Disorders Institute unique to all of the children's hospitals that are in Florida is the strong research that is the foundation of our therapy. The way that we make the survival rates better for cancer in kids all over the country and all over the world is to be able to do studies and to do research.
Can you squeeze my hands? Show me how strong you are.
Taking care of the total child and family is really, really important to me.
Nice and warm. All right.
Throughout my career, having the ability to ask questions, try to answer them in a scientific way, but also be balanced with how do families understand what it is they're dealing with and what therapies can help them. That, to me, all together is the most rewarding part of my job. To see patients be able to leave and have their therapy be completed is unbelievably exciting.
Yeah. All right. Well, you look pretty good. I think you're good.
Thank you.
You're welcome.